What's good, everybody? Sherman Webb, Middlebrooks, lifelong Buffalo resident and full-time Black man, standing in for Pastor George Nicholas again here on Igniting Hope Radio. We have a dope guest for y'all as usual. It's really an honor to fill in for PG on this one because I have the privilege of sitting down with LuAnne Brown. She is the president and CEO of Buffalo Prenatal-Perinatal Network. You try saying that 5 times fast. She's going to be here today.
Just say BPPN, Sherman. It's easier.
Just BPPN? Okay. That's usually what everybody calls it, BPPN.
Right.
And so she's here today to talk about how healthy families start before birth. So without further ado, let's get right into it. So LuAnne, tell us about yourself. What led you into nursing and then eventually leading BPPN?
Thanks, Sherman. Well, nursing, I don't know. I guess, not that I'm old, but I am old. Weren't a lot of options for women like they are now. But I had always kind of steered toward nursing for some reason. And so I went and got my bachelor's at Niagara University, and I started as a new grad at what was then Children's Hospital of Buffalo. And I worked high risk OB. So that was moms who had, diabetes or premature labor. I worked the floor. And then I kind of steered in toward like the management track. So I was in school at UB for my master's in nursing administration. So then I moved into a nurse manager role. Then I was a director for like 15 years over women's services, which was all the OB areas and the intensive care nursery. And actually that's where I met Buffalo Prenatal. And then I took over surgery for a couple of years, and then I was the chief nursing officer before I left in 12. So Buffalo Prenatal, because I was the women's director and what they did, I was on their, we used to go to their meetings, but I was also on their board. I ended up being their board chair. So I've been affiliated with them for a long time. And, after I left Children's and was kind of just enjoying life, our CEO retired, and my friend happened to be the board chair at the time, and she was like, "Don't you want this position?" I'm like, "Not really." But I told her I would do it. I was actually at the food bank, working at the food bank, doing like development and events and volunteer management part-time. And I said, "Well, I'll do it part-time for you until you find somebody." But then I came in and I really liked it, and it's moms and babies. So that's how I ended up here.
Word. That's in all the years we've been doing this work, I don't think I've ever known like that full story, but that's a dope story, and that pretty much tracks. That seems pretty much on brand. So I guess my follow-up question to that would be, what keeps you doing this work? I know you said at the end it's moms and it's babies, and we all love moms and babies. I'm expecting a child in September.
Know that? Congrats.
Yeah. Thank you. Another daughter. Yeah, another daughter. Right.
You're responsible for that. You're passing the genes on.
That's right. That's right. Oh, I've learned from the first one. I'm like, oh, you look like your mama, but you think like me. Okay, cool. Yeah. So just what keeps you doing this work? I know babies are like the greatest symbol of hope, but what else keeps you in the work?
It's funny. I've had several of my friends who have retired, and they all kind of told me that they just kind of woke up one day and said, "I don't want to do this anymore." And I always tell people that I think, when you don't like your job, that's always a good reason. But I love the job. I love my staff. I love working with the clients. It's not as intense as working, obviously, at a children's hospital. So there's a little less stress. I don't think I'm working a little less hours, but I just enjoy it. I like the interaction. I like to see our success stories with our moms and our dads. I mean, when I get sick of it and when it's not fun anymore, I guess I'll retire then, but not anytime soon.
That's a good answer. So we've been talking about BPPN and I'm realizing there might need to be some degree of consumer education for those who...
What we do, yeah.
Exactly. Those of us who may not know you and the great work that you and the organization are up to. So tell us, what does BPPN does? Who do you serve? And what makes BPPN different?
So we've been around since 1987. For some of the older listeners, that was when Governor Mario Cuomo, that was Andrew's father, was in office. And he was very concerned about the high rates of infant mortality and low birth weight infants in New York. So he made these 16 networks around the state. I think we're down to 14 now. We are one of the original networks. So that was our primary focus. So now we have 4 programs. Our 2 oldest programs are Healthy Families New York and the Community Health Worker Program. So Healthy Families New York, they both work primarily on the east and west side of Buffalo and primarily with African American Hispanic moms because unfortunately they have the worst outcomes. Healthy Families is a 5-year program. So we like to get moms when they're pregnant. So we can work with them during the pregnancy, make sure they're going to their appointments. I'll do all the education. But they can stay in Healthy Families for 5 years until the child goes to kindergarten. And they focus on parenting, prevention of child abuse and neglect, child development. And because they're with us so long, I mean, it's not in our wheelhouse, which is kind of one of my goals this year, like self sufficiency, whether that's going back to school or getting back into the job force. So they cover, same as community health worker, east and west side, but they do go a little further out. They do South Buffalo, Cheektowaga, Lackawanna.
Okay. Okay.
Community health worker, more of a focus, I would say, on the pregnant mom and more on the mother rather than the mom and the baby. I mean, the child. And not that all the women are vulnerable in this program, but community health worker, when I first started, they used to get 70% of their referrals from street outreach, going into neighborhoods, knocking on doors, giving their card out. Anybody pregnant here? And we found the last couple of years, of course, it's, when the weather's nice in Buffalo, we haven't had to do that the last couple of years. We're getting a lot of our own clients that are referring family, friends, or
God.
self referrals, which is great.
Yeah.
So, so the community health worker really would find the mom that was like under the bridge, at the bus station, at the train station.
Right.
And, like anything, you can't, they have a lot of social determinant of health issues, and it could be housing, it could be food, it could be they don't have a crib for the baby. And you can't talk to people about their health when they don't know where they're sleeping that night. That's just the reality. It's Maslow's hierarchy.
Yeah.
So we spend a lot of time, that program spends a lot of time those first 2 weeks kind of like just stabilizing the mom, whether it's taking her to DSS to get benefits, whatever they need to do. And then they start with the health education and the advocacy. Both the women's programs, we screen for depression, substance abuse, and domestic violence. And then we make the appropriate referrals. So my staff are not clinical people. They're not nurses like Nurse Family Partnership. They are people from the communities. So the majority of my staff are Black and Hispanic. Like 35% of my staff speak Spanish. Like 12% of my staff are former program participants, which is really helpful.
Huh.
So they look like, so they look like the clients. So they're seen as trusted advisors, and that's why I think the program works. I think the reason we're different is home visiting is different. I mean, you can pick the phone up and call people on the phone, but you have no proof that what they're telling you is true. Sometimes the clients are embarrassed to tell you they don't have something. But when you walk into someone's home, you're seeing their environment. You see the 8-month pregnant mom laying on the floor because she doesn't have a bed. We buy a lot of beds and box springs here, like basic stuff that people should have. Or you open the refrigerator and there's no food. So it's just a different experience. It's a hard job. My staff has a really hard job because you can imagine not everyone wants you in their home. So we really have to gain their trust, and kudos to the staff because sometimes it takes 3 or 4 visits before they trust us. And, they want to make sure that we're going to do what we said that we are going to do.
Yep.
So, and we have very good outcomes, like we obviously, because we're 95% grant funded and our grant is, federal state funding. So we have to have metrics that we hit, and we're always like above the metrics. So things like well child visits, immunizations. I mean, the one I think I'm the most proud of is our postpartum visit rate. So the national average for moms to get their visits is 58%. So that's like a little over half. They get tied up with the baby, whatever. They're busy, they think they're fine. Ours is like 85 to 95%. We do stalk our clients. I mean, we're making the appointment.
That's how you get it done.
We go with them sometimes. We transport, whatever. We want them to go because that's a really key time for the mom to be seen. That's when a lot of mental health issues can jump up. That's when symptoms can occur that they ignore because they're so tied up with the baby. It's unfortunately also the time when most maternal deaths happen after the birth. So you really got to have their eyes on them. And, we see them more than their providers because when the baby's born, we're there every week, so we see them and how they're coping. So those are the two women's programs. Then we started about 7 years ago. Sherman's familiar with this program because he's part
Yeah.
of it. I felt like we were kind of missing the boat with dads. And, the United States has the distinction of being having the highest number of fatherless families in the whole world.
That
The
is
whole
an
world.
interesting stat.
Yes. And, research shows that when there's not a father or a father figure, it could be an uncle, a grandfather, whatever,
Right.
the kids do not have great outcomes. It can be teen pregnancy, they drop out of school, it's drug involvement, criminal justice involvement. So I just felt like we were, not including them. And they're not all deadbeat dads. There's this perception, So we got a grant from Oshai Foundation, and
Shout out to them.
yep, shout out to them. Paul Hogan, he retired, but he was the one that originally funded the program. We started with our buddy Antoine Johnson, who was like 24
Yeah.
when I hired him. Wasn't even married or had a kid at that point, but he was
Good
a
brother
natural.
Antoine.
Yeah, he was a natural fit for it. He really took the program on and founded an evidence-based curriculum. I said it's got to be an evidence-based curriculum because if you get grants, they're going to want that. So we started with Nurturing Fathers and we started with the support group. So Nurturing Fathers, and Sherman can explain this better than I can. It's a 6-week program. They meet twice a week. It's really like a 12-week, but the guys want to do it faster, so they usually meet twice a week. When COVID happened, they pivoted immediately and started doing it virtual.
Yeah.
So the course is great. So they start the first one or two classes, they talk about their history with their father, and that's usually pretty emotional because a lot of times we find the guys their fathers weren't in their lives and they want to do better.
Mm-hmm.
But then they tackle topics like engaging with your child, disciplining your child. We have to spend a lot of time, as you can imagine, on communication and co-parenting.
Yeah.
Because many times they are not with the mom in a relationship anymore, but they still have a child together, and you want that to be good environment. So they get through all that. There's usually like 10 to 15 guys in the in the class. I love these classes. Yeah, I love these classes. So when Antoine first started, I remember the first one I went to was at Delavan Center.
Delavan, right.
I said to Antoine, I said, they're probably not going to talk because I'm going to be the only woman in the room. They are so chatty.
Mm-hmm.
It's like amazing to me because I think it's a safe space for them to talk.
Yeah.
They're not going to talk about this stuff with their friends, their guy friends, like at the bar or at the gym or at work, whatever. So, but they're very open and very vulnerable about what they're struggling with and how, with their child or whatever. So I love this class. So it's been going on. I will tell you that I'm looking for money for this program because they've sustained themselves for 7 years. So we're going to be hitting up a lot of people. So if there's anybody out there who really feels strongly about fatherhood, this would be a great program to fund.
Yes,
but they also do, yeah, right. And besides that, they mentor a lot of these young guys.
Yeah.
They teach a different curriculum, which is called Inside Out Dad, which is for incarcerated dads. And they teach that at the Alden Correctional Facility in the Erie County Holding Center. And those guys, well, and no pun intended, they are kind of a captive audience. They're there anyway, right? And they love the class. They graduate, and we actually try to tap when they get out, like especially when they get out of the holding center. In the past, we've tapped those guys to teach the class.
Yeah.
In fact, the last fatherhood class I went to, there were 2 guys that had been released from prison. And I said to Terry, I'm like, those would be, he goes, yeah, we're looking at them for facilitator because they could just, they're more credible, I think.
Right.
So they do that. They try to work with them on workforce development. We run a lot of activities there. They're in a big recast program grant right now through the state, which they do a lot of activities, whether they do fishing. In fact, there's a fishing trip tomorrow or Friday, Saturday.
Yep.
They go to Explore and More. They just did a Father's Day brunch. They're doing a family picnic on July 11th. So they're kind of all over. And they always do the classes out in the community.
Yeah.
The new thing that Terry added this year, and Terry Say is the new program coordinator because unfortunately Antoine left us, but he's wanted to do one for couples. So
Yeah.
we call it the Ma Pa class. It's like marriage and parenting, but where the couples are there. We just kicked that off this year. And it's growing slowly. It was like two couples at the first time. And I said to Terry the other day, I said, Terry, you got to remember when we started, it was the same thing with the fatherhood class until the word gets out there because it does make sense. The guys would come to the nurturing fathers class and they're all excited. They go home to their partner and their
Yeah.
partner doesn't know what they're talking about.
At all. Yeah.
Yes, right.
Yeah.
So now
Yeah.
they're in the room together talking about the same issues.
Yes.
So that's our new edition.
I
And then our
love
fourth,
that edition.
yeah, yeah. And then our fourth program was actually started by United Way, got a grant with a federal grant because they had actually done a focus group with our clients probably like 15 years ago now. And one of the barriers our clients have is transportation. They don't own cars. They rely on public transportation a lot. And because of that, they weren't always diligent about going to their prenatal visits. You can imagine you're 7 months pregnant, plus you got a 2-year-old toddler trying to get on the bus, get there on time. So they wrote this grant, and it's called Go Buffalo Mom. We ended up taking it over. United Way asked us to take it over, so we hired the person. So we have a transportation navigator, Ashley Stevenson, and she basically works with she works with anybody, but any prenatal clinic, people just call her, and she will help them either get bus passes or if they're eligible for Medicaid cabs, she will get them onto that. And she may book all their appointments out so they go. She also teaches them how to use the Medicaid so they can book their rides because it's important. If you don't go to your prenatal visits, that's when we pick up things that, could be problems that we could fix. We've had evaluation of the program and we, obviously can't take credit for every full-term baby, but they did find that the moms that were in Go Buffalo Mom had more full-term babies. And if their babies were in the intensive care nursery, they stayed a shorter time. So for that reason, it's a great program. We have about 60 staff, and we are right in the corner. We have a lovely location now. We were for years on Delaware next to the Theodore Roosevelt, but now we're right in the corner of Washington and Tupper. We got a great awning. People know where we are. And,
Yeah, you can't miss it on the expressway every day. I see
right.
it now.
Every time you get on the 33, you see us.
You can't miss it. Get on the expressway.
Now, as far as referrals, like I said, people always, well, how do we get referrals from agencies, hospitals, but, you can go on our website, which is bppn.org. All the programs listed, you click, there's a form you fill out. And then we kind of, like for the women's programs, we kind of triage. We'll look at the mom and see what program would fit her best. Kind of triage them and put them in the right program, and then assign them a caseworker, and then, they're off to the races.
This is dope. I'm really glad that I'm filling in for PG on this one. Because I honestly like a lot of just the work that I've seen and done has been through like either through my role as a community health worker with Justin Connect and the Community Health Worker Network of Buffalo. So working with the wonderful women who did that program and then finding out about the fatherhood program and then being able to have that opportunity to work with the good brother Antoine, Terry, Mike, Jamal, the whole crew. So I had kind of like a small window into what was going on with BPPN.
Right.
But now I get like a fuller picture. So yeah, this is pretty cool. So when it comes specifically to Buffalo, what would you say are some of the biggest maternal and infant health challenges in Buffalo specifically? And do you think like the stress from like you touched on like housing, food, transportation, stress, but I'm also wondering how you think racism factors into some of these challenges with infant and maternal.
Yeah, I think, yes, the social determinants of health, but, obviously our goal is to have every mom have a healthy full-term baby. The racism factor is very real. If you look at the maternal mortality report, which I referenced before, that's the group out of New York State that reviews every maternal death. And, they find that women of color are 3 to 5 times higher to have a bad outcome. And people will say, well, why is that? And some of it's social determinants of health. Their health might not be as great because they didn't have the best education, they don't eat right, they live in unsafe housing, all those things. But when they looked at the deaths in New York State, they said in 58% of them there was some element of discrimination, and they also said, which is even more heartbreaking, that 72% of the deaths were preventable. So I think implicit bias is real. We've talked at the African American Health Equity Group, which, you and I are both on, Sherman, and it was such an issue. I was working on a project with a woman from California that's an actress and a playwright. She had put this kind of show together. It was called Can You Hear Me Baby? And it was different vignettes with like a single mom, a mom who loses a baby, but set to music. And I had seen it at a conference, and I really wanted to bring it to Buffalo, and show it publicly and also show it to clinical people. And then, when the maternal mortality thing blew up, and I will credit Serena Williams with this, because when Serena Williams was pregnant with her child and she knew she had a pulmonary embolus because she had had one before. And here you have a smart, well-resourced woman, and people weren't listening to her. And I think that blew up everyone's thoughts about. So I said to Lisa, my partner, I said, I really think we should do something on implicit bias. And our real goal was to get it into curriculums like at medical schools and nursing schools, social work schools, show it to doctors and nurses in hospitals. So anyway, we got some funding, very generous funding from the Health Foundation. And what we did is, Lisa, the creative one, they were all true stories. A couple of them were my clients from Buffalo Prenatal, but she used Serena Williams was another one she used. But there's enough stories, unfortunately, in real life nationally that happened. So she wrote 11 stories, and actually this was Pastor George's. I was talking to him about the project, and he said to me, "You should hire 11 actresses from Buffalo." Which is what we did. So we hired 11 actresses that were Black or Hispanic, and they told the story. So we actually filmed it at Theater of Youth last July.
Okay, cool.
And, they were actresses, so they acted the story out. We videotaped them. Lisa had them all edited. We've been in conversation with the University of Buffalo to, explore this idea with them, and they agreed to pilot them. So it's actually in one of their curriculum already. They just started, they kicked it off. So anyway, there's these 11 very impactful videos, I will say, that are hard to watch because they don't tell great. I think we have one story that's kind of got a happy ending, but it kind of attributes the whole implicit bias thing. And, when they talk about implicit bias and the impact and why women of color have this impact, and they've attributed a lot to, and I can never remember the researcher's name, but she attributed it to weathering, which basically says that Black women live with racism their whole lives, and subconsciously it's impacting you. It's impacting your hormones, your stress levels, which could cause premature labor. It's a very interesting topic because they've shown that even women who emigrate here from Africa don't have the same outcomes because they didn't grow up in that environment their whole lives.
Right.
They've also shown that a Black college educated woman, still has worse outcomes than a white high school graduate. So anyway, the videos, I just presented them actually at the New York State Perinatal Association. UB's using them. I'm in conversation with other local, but we really want to push this out nationally because, in New York, all the universities and all the healthcare facilities have to do some type of implicit bias training every year. So this kind of takes that job away from them. I'm in conversation with Catholic Health and Kaleida Health, for them to lease them, and we'll see where it goes. But I think it's a different way to learn. You show the video. When I did it at the conference, I showed a video and then we talked about it and how it impacted people and for them to see. And, I'm a nurse. Nobody goes into healthcare because you want to be biased, but I don't have the lived experience of my clients, let alone my staff.
Right.
And sometimes you don't know what you don't know. So I think it's just kind of a wake up call for people to say, maybe I did that, and just kind of reflect on their behavior. And obviously, we want to see behavior changes. So that's an exciting project we're working
Yeah.
on right now.
That's dope. I think honestly, when it comes to that, because even if to take it back to what we do in the fatherhood program, it's you're creating an opportunity in a space for people to have a conversation that they might
Mhm.
not otherwise have a chance to have.
That's right.
And I love the idea of watching something on film. I love sports, and I just love the idea of watching tape, watching the film. So like, oh, I went left when I should have went right. But like, if I don't go back and watch the film of my performance or sit back and analyze myself, if I never have the time to reflect, because life has to keep going. There's another task. There's another responsibility. There's another obligation. There's another place I gotta be. Another thing I gotta do. Days start piling up on you. It's kind of hard to take a moment back and reflect. Like, well, I know I'm running 100 miles an hour, but am I running 100 miles an hour in the right direction?
Right.
Am I taking care of myself along the way? Am I running out of am I running out of gas? Am I running out of fuel? You don't really have the opportunity to reflect. So I think what these spaces that you're creating, that your staff is creating as well, is really offering that opportunity for people to pause and reflect and engage and have conversations in spaces that just usually don't pop up in everyday life.
No, no.
That
And it's,
within, yeah,
yeah. And I think, and I always do the trauma informed care introduction at the beginning because sometimes it can trigger people, and
right,
I said it
right,
at the conference. We did it for our Maternal Child Coalition. When I showed it, I said, we feel like it's important for you to watch these, but you need to take care of yourself first. So if you need to step away, you have to say that to people because you don't know who's in that room that could have had a bad or lost somebody to a maternal death.
exactly, and that's the one thing that as we continue to grow, just being mindful of those spaces, and just you. That's the one thing that like I know when I'm facilitating the whole space is that I don't know, and I have to be open to like being approachable, being accountable, but also being corrected. But it's making me think too when it comes to the work that you're doing and the work that I'm doing here over at the center, holding space for fellas and working with dads. I'm curious. We talked about like what we've learned working in community. What have you would you say have you learned working with dads recently, and what advice would you give to new fathers? I'm curious.
I mean, like I said, I think sometimes dads, get a bad rap, some for good reason, but
Mhm.
every guy is not a domestic violence perpetrator. And I think historically, and I think with black men, they've had that thing where, whether it was, and this is going back years to the plantation where they separated families and the father wasn't with them and it became a very matriarchal society.
Yeah.
And that was nobody's fault, or now that they can't live with the mom because that's going to impact her benefits. There's a lot of barriers that keep dads away from the families. But I think what I've learned when I see these guys that really want to do well, and the research shows there's a lot more dads do a lot more physical care sometimes than moms, and black dads especially. So I think if you give them an opportunity, I mean, the thing with men, and I think black men especially, is that whole they feel like they got to be the breadwinner.
Yeah. As a
And if
black
they're not,
man,
yeah,
yes.
and if they're not in a good economic position, I mean, I almost like they feel like it's better for them not to be around, which it's not. I mean, that's not what the kid wants. The kid wants you there with the presence. I mean, you can see that when we sometimes we do with Say Yes, we do the take your daddy to, daddy and daughter, kids
Yeah.
school.
Yep. Yep.
And I'll tell you, when we go in, I've gone to a couple with Terry and Mike, and the kids, the dads walk in, and the kids are all like, they're all aglow because when they see their father, they're looking for their father. So it's a different relationship, and the mother's just as important. But I think we've given guys a bad rap, and not because they also show that when a father's involved, like in prenatal care and with breastfeeding and is supportive, the mom does better.
Yeah.
If they're supportive, I mean, nobody wants to go through a pregnancy and a delivery all by themselves. And I think that the men being there can really have a positive impact on the mom and the baby.
Or, yeah. And a lot of that that you shared, I've definitely had some of the fellas in the group say, because I think that was some of the more interesting conversations, and I just had to gain like a different respect for some of the dads who
Hmm.
came to our program from a place of I haven't been there, and I want to learn how I can be there now.
Right.
And I know it's not going to be easy. I know I'm going to have some tough conversations, especially when they have older kids or grown kids. Because now, like, oh, they can tell you exactly how they feel, and nobody can get to you how your kids can get to you. And so, just I remember with some of the dads, just like really being a stand-in and letting them practice that. So, like that first time they had that conversation wouldn't be their first time having that conversation. They can kind of get some of the hiccups out of the way. So just thinking about again, like some of the opportunities that these spaces create to really heal families. So I'm also going to ask you, because you also said too that moms are just as important, and I totally agree. So what advice would you give to new mothers, and what have you learned about moms?
Yeah. Well, I think that, you know, I mean, obviously the mom is a very important role in the child's life. And, and I think that she needs to keep herself healthy, both physically and mentally. And, mental health, Sherman, as you know, you're running, I mean, we started because it's such an explosion with mental health issues. And because we screen, and, I pushed Terry and Antoine about the fatherhoods. I said, guys, the men are depressed too. You just can't ignore. And I'm not telling you got to counsel them, but you at least screen them and then get them to somebody. Because so I would say to a mom, take care of yourself physically and mentally, because you're going to be no good to that baby if you're not. And I will say this, and I did not breastfeed my children. We are big breastfeeding supporters. We run a baby cafe here, and it's wonderful for the mom and the baby. However, I don't like when they guilt moms into it. I
Mm,
mean, if a mom wants to do it, that's wonderful, because they've shown if a mom is feeling pressure to do it and then she doesn't succeed, it causes mental health issues. She feels like a failure. So I want women to have the option. If you want to do it, it's great, it's beautiful, but I just don't like to see people pressured into it, because I think that does not go well for either of them. So I just think it's keeping yourself healthy, being there, taking time for yourself, because, at some point that child's going to grow up and leave you. So you got to have a life outside your kids. I mean, and when it's work, I mean, I worked full time with all my children. I mean, I was lucky. I had family around that watched them when they were little. And I do think it made them pretty independent, because I wasn't there at the drop of a hat sometimes. It's like they had to think a little bit about for themselves. But I just think it's, and making sure that that child is in a safe environment and healthy environment, because it impacts them. That's why this type of program is so important. I mean, people, like, and I mentioned, like, one of my goals this year, because when I do get asked the question, people want to, okay, well, that's great, you get them to have healthy babies, so what else do you do? How, like, it's like a handout to people, and I'm like, it's not a handout, it's a hand up. I said, and if you want this mom,
Hold on, run that back for them. It's a what?
it's a hand up, it's not a hand out.
Really, I like.
And I think that, you want these women to be, or dads to be responsible citizens and pay taxes and contribute to the society. It all starts with the mom and the baby. So that's why these type of programs are so important, because you have to start them off on the right foot. I mean, I always, and when I talk to people who like to talk money, I always say to them, okay, you don't think this impacts you, but it does impact you. I said the cost of a premature baby, national average is $65,000 every time a premature baby, because it's not just hospital costs. It's assistive devices, it's special ed, which we all pay for in our school taxes, right? So I always, when I compare my delivery numbers every year and look to see, how our moms and how many were full term, we save $4 to $6 million every year just because of that.
Mm.
And I because once they're 12 years old, you miss, the brain is developing when they're young, so that
Yeah.
mother has to be nourished, the baby has to be nourished, and the father has to be nourished. if you want to have responsible citizens, so I'll get off my soapbox now,
No,
but
I couldn't agree more. After you see, I shut up. I wanted you to keep going, but no, I think like I think you have such a privileged perspective of being able to see what happens, and you're making me think about my privileged perspective of when I'm working with teenagers in my life, just mentoring. I'm like, no, I have the privilege of being 20 years away from my freshman year of high school. I know what happens after we graduate. I know what happens when you sit at the wrong lunch table. I know what happens when you don't make the right group of friends. I know what
yeah,
happens when you don't like decide to get into something and be involved and engage and find a passion. So like you have the perspective of like, okay, I know what happens when a child is born early. I know what happens or premature. I know what happens when that child then has to enter the educational system. I know what happens because this child is going to be a frequent flyer in the medical system. And I also know from a financial perspective, the burden that's having on us as a larger society. That is such a beautiful perspective. And I
yeah.
can see why the fire still burns in you to continue to do this work, because how could you walk away? Like it's almost like you in the Matrix, because you know a little bit too much, you know a lot.
Is they got the Keanu Reeves? I don't think I even saw that movie, but okay, the Matrix. I know what it's about, kind of.
Yeah.
But well, and I wanted to mention too when we were talking about the mental health thing. Again, we screen, but like the CHW program, it's got to be like 6, 7 years ago. Marixa came to me and said, because probably 95% of my clients have some type of mental, either anxiety or depression, whatever. But there's that stigma about seeking help. And some of it's a cultural thing. We have a community advisory board through Marixa's program, and it's our clients that are close to graduating. And we're just actually, those women are all working now, which is wonderful. And now we're bringing a whole new group on. But we do a dinner every year with our board members and the cab members, and they kind of like do speed dating and talk about their goals. And I was sitting with like three of these young Black women, and we were talking about mental health, and they all had issues, depression, something. And they all said the same thing. They said, my mother told me to suck it up. So when we saw this happening with our clients, we started doing, and we're not, we bring a counselor in and they meet with the moms because we're not mental health specialists, but just to kind of get them comfortable with counseling. And then the goal is to get them into individual counseling. And then it kicked off with the guys. Once Terry and Antoine listened to me, he said, okay, we got this guy. He's going to do this class. He's from Best Self. And he said to me, we're going to do it every 2 weeks. I go, really? I said, that's a lot. I said, the women do it once a month. And he said, well, we'll see how. I'm telling you, they need it every 2 weeks
Yeah, yeah. I
because
do.
they're probably more likely to keep it inside.
Yes, yeah. Listen, we do our group at the Center for Health Equity every second Monday of the month,
Right.
and the way like we were doing it like twice a month, but it honestly became a lot on me.
Yeah.
And I was like, oh, okay, like as far as like the capacity we have right now as a staff, like I could do this once a month. Like otherwise, like somebody gonna have to start another group just for me
Right. Right. Right.
because I'm an empath.
Yeah.
And like so, and also just it's just a lot to hold space. And my greatest like I think my greatest accomplishment as a facilitator when I know the group is successful is when I say like, yeah, we're gonna end that, we're just gonna be from 5 to 7:30. And I look at them like, it's 8:30 and like we ain't checked out yet. And like they still want to stay here. And like, hey, like my daughter's at home doing bedtime routine. I ain't got nowhere else to be. Like if y'all want to be here, because like you could be anywhere else in the world, but you rather be like here with us having this conversation. And I think for me, like that is one of the greatest gifts like we could ever get as a facilitator. And when I'm thinking too, just about the mental health space, there's this radio host called Charlemagne, and he said we are the first, and he's a little bit older than me, but he was saying like we are the first generations, specifically of Black men. He was saying with the privilege to heal. He had a book called Black Privilege, and that was one of the chapters in his book. He said that we're the first generation with the privilege to heal. And like when I look at my dad, when I talk to my uncles, yeah, yeah. I remember vividly my uncle telling me I was about 13 or so. I was getting in trouble in school. And he was like, hey, man, you're going to have to figure it out because I don't know what you're going to do with your life. I'm going to tell you straight up, my nieces will never be homeless because my uncle owned a few houses. He was like, my nieces will never be homeless because they're women. But my nephews, hey, y'all going to have to figure it out because y'all men. And I was like, so, but that's like in his mind is like, hey, you a man, you got to figure it out. But like, we take care of the women though, take care of the women and the children. But as a man, you got to go out there and figure it out. And now that makes you uncomfortable being vulnerable in certain spaces because of how you might be looked at or judged. So I definitely think that that having these spaces is incredibly important. So I guess as we begin to wrap up, some of my final questions are: what's next for BPN? What are you most excited about? And how can the community get involved and support the mission?
Well, I mentioned the the thing about the workforce development, which again is not in our wheelhouse, but I feel like my goal this year is because there's plenty of people in the community that do workforce development. We don't need to reinvent the wheel. But I really feel like we need to link with those organizations better and work more closely with our moms. Like our junior board here, which is a group of college students that some of my board members and Denise started. They put the whole thing on. They had all the workforce development. We had like 100 people come. A lot of our clients, two of our clients got jobs from there. So that's one of my goals. My other goal, and Marix and I have talked about this, you don't want to do mission creep, but you also have to look at other ways when you're 95% grant funded to make money, and especially in this environment that we're living in right now. But I said to her, really, and you're a community health worker, Sherman, so you know this. It's a certain skill set that you need to be a community health worker. That doesn't mean you can't work with other populations. You just need to learn the resources and the support. So I said to her, we talked about elderly people. I said, there's such a need with elderly people, and how great would it be for them to have a community health worker like our moms do? Right. So her and I have talked about that. I'm trying to get, in our building. Well, this is Anne Marie Correa. She's my program manager, Healthy Families. This is her dream, is that we have a resource center for our moms. And we actually have space on the first floor of our building. It's got to be reconfigured. So I'm kind of trying to work on that. So it would be a place for moms. We'd have computers so they could like work on whatever, if they had to do a resume, a play area for the kids. I'm looking at we have a program that we did, another trauma informed on Survivor Mom, which Mickey Spurlick from the university actually created. It was the first perinatal trauma informed intervention. And she trained some of my staff to be tutors, and the moms either read or they listen to these modules. They're like vignettes. And then they go back to their tutor. And there were unbelievable outcomes with that program. We did it like with 50 moms. And some of these moms told stories they had never told anybody else. They had never told the story before. So we ended up getting this big NIH award, which we just kind of did in a fling, like, let's just apply and see. And we ended up winning like $200,000. So we're trying to do it. So we hire a social worker. I'd love to have my community health workers do it because I think it worked well because the clients liked them. But if I had an LCSW do it, I can bill. You got to think about that stuff. So that's a program we're looking at doing. I think I don't see us moving. Housing is a huge issue. I mean, I'm complaining about that every day. In fact, I got a call with somebody next week because, we're doing the 1115 waiver, which, Marixa staff is doing. It's a lot of work, but it has been so life-changing for our clients. Like we've put like 60 women in apartments.
That is amazing.
We've been having food delivered we got a call, we got an email from a woman that she was so depressed. She was down to 80 pounds because she didn't have any food. And we started having food delivered. Now she's like 100 pounds. She's 20 pounds up. She's like engaging with her child. The program itself is great. It's just, so we're trying to see how we can, because that ends in March of 27, but it's things that there's some of that stuff we can bill for still. So there's things we can do. Like I said, I don't want to get too much off our path because that's when you lose yourself. But those are the things I'm thinking of right now. How else? What other kind of business plans can we do that we have unrestricted revenue? So we're not so totally dependent on grants.
Yeah. Well, I think definitely the work that you guys are doing with holding these groups and spaces, and I think there's a lot of training opportunities. I know I've been part of many an organization that has ran a hybrid model of doing some grant funding stuff and then doing some for profit work as well. So I think
Right.
the the need unfortunately is there. But fortunately you're there to fill the need and work on it. I would always say that I'm not even though I work for a pastor, I'm not the most religious person, but I do love that scripture, and I forget how it goes, but it says, "Here I am, Lord, send me." And I think like those are also the kind of people who I want in my foxhole with me doing this work. The folks are like, okay, there's an issue in the community. We could sit around and complain about it, or we could sit around and plan around it. We can make a choice. We gonna have this time on this spinning rock. What we gonna do with this time on this spinning rock? We gonna complain or we gonna plan? So I want to be around the people who are looking to plan and get work done. So I do have a quick lightning round, and I want to get some stuff from you real quick, and
Okay.
it feel like you almost got my notes because I'm looking. I'm like, she done answered all of these, but the first one I really want to start with. What's the biggest lesson you feel like you've learned as a leader?
I think the biggest lesson I learned is that you have to listen to the people closest to the clients. I mean, whether I was in nursing, and I'm up here, I'm not taking care of patients, but my staff is. And so whenever there's a new project or whatever, I shouldn't be the one, you know what I'm saying? I'm not doing it. So I think it's really important that you involve the people that are closest to the situation, and also that you care about them as people. It can't just be, you're here to a wheel and a cog here. I mean, it's important that you know about those people and what they're dealing with, and that you take the time to talk to them sometimes about not work stuff. So I think that makes a big difference. It's all about the emotional intelligence piece. I mean, I've worked with a lot of smart people that who could not lead people because they just did not have the credibility, and people didn't listen to them. So I think that's probably the most important thing to me.
That's beautiful advice. I appreciate that on a personal level.
Mhm.
Okay, one word to describe the city of Buffalo.
Evolving.
Ooh, okay, I like that. I like that. What's one health myth you wish would disappear?
That vaccines are bad for people.
Ooh, okay, okay, okay. And the last one, because this is Igniting Hope Radio, what ignites you? What ignites hope within you?
I think the success stories of our clients or my staff, we have staff that stay with us for 3 to 5 years and then move on to a better opportunity, which is great. You hate to lose them, but it's a good thing. And then we have staff that stay here for their whole career. So I think when I see our clients succeed, or I see my staff, do something, and it's like a typical nonprofit. We don't have a lot of room for, like, you're either a line worker or you're a manager. So I feel it's important to give people an opportunity to do other things. So, we have people that are trained. I have some of my staff that are trained as doulas. I have some staff that are trained as certified lactation consultants that can work with breastfeeding. So there's different opportunities you can give people, even though they're not at a different level, but it helps them with their resume. And I think that's your job as a leader, that you're supposed to be developing people. You don't want to lose them. Like, I hated to lose Antoine, but I mean, I knew that it was only a matter of time that I kept him 5 years like I did. But you know, it it's great for him, and he's going to have a great career.
Yeah, I love good brother Antoine, and I think again, as in terms of like a sports analogy, when they talk about who the greatest coaches are, it's like, all right, you won, but who did you bring up? Who's part of your coaching tree that also came and won too? Or was it just you that did all the winning? So like those are like the greatest coaches, the ones who have a vast coaching tree of people who they brought along the
Yeah.
way, who
Yeah.
they led to do some winning of their own.
Yeah, that's your job. And one of my, and I was very lucky. I always had really strong, and most of them were female managers in nursing, that, but I remember one saying to me, you always surround yourself with smart people because they make you look smarter. And unfortunately, there's some leaders that don't do that, or they don't want that because they don't want to look. I mean, they're insecure or whatever reason, but you should have people around who you look better than you because they do make you look better.
I appreciate that. This has been a great conversation,
I
LuAnne.
know, Sherman. It's like 2 days. I've seen you over the weekend and like 2 days in a week.
Right, right. This is good. So it's a good
Oh my
week.
God. And that was such a beautiful, that whole thing. And that, what's her name? The one that ran it? You,
Jessica?
Jessica. Oh my God. But I was like bawling my eyes out between the guys. And then the guy sitting next to me who I didn't know, and he's telling me about his wife. And I'm like, that's where you see men step up. Like really, three men up there talking about taking care of their moms. This guy was taking care of his wife who
Yeah,
doesn't is nonverbal.
yeah.
And just it was a really nice event.
Yes, it really was, and it was great just to see like that caretaking because, and that's my grandmother had 7 kids. My mom is the only girl, and so it was very normal for me. Like the men did all the nurturing in my family because my mom was the only girl,
Right, right.
and so I'm very used to that. Like it's very normal for me to, and so I think that's always been the approach that I've taken to communities, is being a professional family member, treat them the same way my uncles treated me, the same way my dad, my stepdad, my cousins. Like I've always had men in my family that have looked out for me, even to mentors and coaches. So I feel like almost like a debt, like almost like survivor's remorse in kind of a way when I'm
Mhm.
around certain people, because I'm like, I've had so much given to me, and so it's like, that means I owe. I have to give back what's been given to me.
Right.
Like that's just kind of
Yeah. It's
the
yeah, what is
responsibility.
that saying? To those much is given, much is expected.
Absolutely, that's
Yeah.
absolutely how I feel. And so yeah, this has been a wonderful conversation. I'm
Yeah, Sherman.
kind of glad I got to fill in again for PG. This was dope. So, is there anything else that you want to say or share about Buffalo Prenatal-Perinatal Network (BPPN)? Any
Oh,
upcoming
you can
events?
always support us financially. Actually have our big fundraiser coming up July 22nd. Great Baby Beginnings. It's at the Wurlitzer. It's like a 5 to 8 dinner, drinks. We have a basket auction, a live auction. We have a fun thing, and then we actually give awards out to people that work in the perinatal area. So we have 2 physicians. We have a neonatologist and a maternal fetal doc, one from the Catholics and one from Kaleida. And then we have this wonderful organization called Pete's Pillows that it's actually, they live in like around the corner from me in Lancaster. But it's all these women, they get together and they sew like baby, like for my clients and a lot of other clients, different agencies, baby blankets, bibs. I mean, they're wonderful. So they're getting our award. But the other thing we have is it's going to be a separate silent auction. Is Bill Fichtner. Do you know who Bill Fichtner is? He's the Buffalo actor. He was in Armageddon. You probably saw it.
Okay,
He was
okay.
in Mom. He was banged the drum at the Sabres. Anyway, long story short, he was my brother's roommate at Brockport because Buffalo's one big living room. And
It really is.
he does fundraisers. You know, he's a very accomplished actor, but comes home to Buffalo a lot. He's a big Buffalo booster. So he's actually generously donated that and Hutch's. So we're gonna raffle off. It's gonna be a dinner for 10 at Hutch's with him, which will be fun because he'll tell stories and he's very engaging, very down to earth. So I was thrilled he did. He did a video for us that we're going to show that night, and so I'm excited about that. But I was over at Hutch's yesterday, kind of walking through it with him, so it'll be fun. So that's July 22nd. Tickets are on sale.
Cool, cool. So y'all heard it first here, July 22nd. The silent auction tickets, right? And what was the other date? July.
July 20th. Yeah, so July 20th. So the tickets actually I think are 95 now. They go up. I don't know when they go up, but they do go up in price. But yeah, so dinner, drinks, silent auction, live auction, and the special auction with Bill Fichtner.
Word. So if you want to support the wonderful work that's being done to help, I mean, however you're helping everybody, you're helping the whole city. You're helping the mothers, the fathers, and the babies. And so it's been a privilege to even be a part of the organization, working with the dads, working with the community health workers. And I look forward to continuing just doing my part to support the work that BPPN is doing, just because I benefited from it too by being part of that first fatherhood support group and then becoming a facilitator. I know the impact that program in particular has had on me, how it shaped how I show up as a father, how it shapes how I show up as a co-parent and as a son and as a brother, as a nephew. And it definitely, on a personal level, has improved my own personal relationship with my father, giving me the opportunity to have conversations that were healing, just talking with guys who maybe don't have that opportunity because their dad's no longer here. So I personally want to thank you for spearheading that program that, like I said, has personally benefited me. I like to give people their personal flowers and their thank yous while I can. So for LuAnne Brown, the president and CEO of Buffalo Prenatal-Perinatal Network, I am Sherman Webb Middlebrooks, lifelong Buffalo resident, full-time Black man for the Buffalo Center for Health Equity, filling in for Pastor George. We're going to close out, and in the words of my hero, the late, great Honorable Jerry Springer, y'all folks out there, take care of yourselves and each other. Peace. That was good.
Yeah, it was fun, Sherman.
Thank you.
All right.